project that I've been involved in has been implementing esophageal Doppler, which is a cardiac output monitor for patients undergoing major surgery. We as anaesthetists have to give intravenous fluid to try and get the fluid balance right. Now if you give too much fluid, the tissues of the body can swell up, which can be a problem for the patient. But equally, if you give too little fluid, the patient becomes dehydrated, and that can become problematic for them, and they can experience complications.
This is one of the Technology Adoption Centre's first projects, and one of the reasons why we were very interested in the implementation of this particular technology was that there was a strong evidence base for this technology for a number of years, yet it was only being utilised in around about 5% of major surgery cases. The approach that we took with regards to this implementation project was to approach three organisations to implement this technology in the routine clinical setting. One of those project sites was Manchester Royal Infirmary. We took a structured, systematic approach to implementation, developing a local project team that was very much clinically led, and the approach was to try and mirror as closely as possible the routine NHS environment.
After we'd implemented the esophageal Doppler and we were using it to help guide intravenous fluid therapy and getting the balance right in fluids for patients having major surgery, we found that for over 200 patients in our hospital, we were able to see a reduction in length of stay of over 3 days. And we were able to achieve this reduction in length of stay because patients experienced less complications following their operation, which is a really good thing for patients, but it's also good for the NHS because by reducing complications and reducing length of stay, the NHS can then save some money, or it can use those beds that the patients would have otherwise occupied to treat more patients. We also found that even though patients were leaving hospital earlier, the numbers who were needed to be readmitted to hospital was actually less. Also, the number of reoperations was reduced. And so we feel that this really secured some extremely good benefits for patients, and it was well worth all the effort of the whole team who were involved in the project.